Anxiety is common, and some of the research suggests that it's becoming more common, especially with teenagers. In my experience, anxiety is harder to treat than depression. The commonest form of anxiety is generalized anxiety disorder, which is a fancy way of saying you're anxious almost all of the time at some level. Then you have panic disorder, which is a very high level of peak anxiety, can be accompanied by a feeling that you're going to lose your mind or come out of your body or have a heart attack, or you can't breathe, or you get pins and needles and your hands clench. Then there is social anxiety, where people basically are scared of other people, not scared that they're going to be attacked, but they often think that people are judging them harshly, they're failures, they don't know what to say, they're stupid, they lack confidence in a social situation. And people commonly treat that by having a drink before they go out socially, or just not going out and modifying their whole life so they just stay with what is familiar. Then obsessive compulsive disorder used to be a special form of an anxiety disorder, but I think it's completely separate. So obsessions are irrational, persistent, iterative thoughts that upset you, such as, I've got cancer, I've got cancer, I've got cancer, I've got cancer. Or another thought is, if I drive, people are bad on the road, I'm going to have a car accident. If those thoughts are common, we all have them, but if they persist and just go round and round your head, we can call that an obsession. And then the compulsion is when you act on the obsession and do something physical. So common compulsions are counting, having to count in sevens, or not walk on the cracks, or having to wash your hands all the time, or having to check that you turn the gas off. Or if you're working as a literary editor and having to check 20 times that you've got the spelling right instead of just 1 or 2 times. So we have good treatments for obsessive compulsive disorder. We have reasonable treatments for the other forms of anxiety, which is usually psychotherapy, specific types of psychotherapy, including CBT, and exposure therapy. So if you're scared of social engagements, part of the treatment wouldn't be just in an office talking about it, but would be a gradual exposure to social situations, starting with the least threatening and very slowly working your way up to the most difficult one. So those are our standard treatments. However, I should add, and this is my own personal view, is that even our standard treatments with anxiety sometimes don't get the results that we're after. So sometimes you have to look a bit more deeply into it. Is there an underlying subtle paranoia? We have to use an antipsychotic. Is there a fragile personality that's always on the verge of collapsing, and we need to do long-term psychotherapy work to build up their personality? Are they on the autism spectrum disorder, which means they're always anxious because they're always trying to decode social situations, so standard psychotherapy wouldn't work. So if we go, or are they on the verge of getting early dementia and they're not quite sure what's happening, but they know that something's happening, and so they're getting anxious because something out of their control is coming. Or if you're an elderly person and you've had a heart attack or a fall, and you start to worry about your mortality, and you just become anxious because you don't know what's around the corner. So all of these special circumstances need to be taken into account in devising a treatment plan. But if we go back to the standard anxiety and the standard treatments, it is still my experience that our treatments are not as good as the treatments for depression. So I personally favour the addition of complementary alternative treatments to anxiety. I favour exercise, I favour swimming, I favour Reiki, which is a special form of massage, which is really good in the treatment of anxiety. I favour meditation and all sorts of different types of meditation as a way of dealing with anxiety. And there's another group of treatments called body and energy treatments, which I studied in California a long time ago. I don't do them myself, but I would work with a local alternative treatment provider and add that into the mix if I thought it was appropriate. So I always try and keep a balanced, wide view as to what treatment is best for that particular person.